One of my runners came to see me the other day because of some horrible nagging pain at the front of her hip. She said that she would get this pinching, aching feeling at the front of her hip every time she ran, every time she climbed the stairs, every time she went to stand up after sitting for long periods of time. She said she felt like she'd aged 30 years every time she woke up in the morning. It was this searing pain that was just driving her crazy. Now, I'm going to go through the top 3 mistakes that people make when trying to treat this kind of pain. My name is Ed. I run a physio practice in Tooting, which is in southwest London. We specialize in the treatment of running injuries. Let's get started. So let's start with the first mistake that people make, which is misdiagnosing it. People think immediately that they've strained their hip flexor. Now, your hip flexor is a muscle that lives at the front of the hip. People kind of just believe that because that muscle lives there, that's the muscle which is irritated. But actually, hip flexor strains are more common in things like football because that involves things like kicking. With running, the hip flexor muscle doesn't work that much compared to, say, your hip muscles. So, for example, your glute max, calf muscles, your quads, your hamstrings. So it's much more unusual to get someone who has a hip flexor strain come in to see us from running. What's really important when you have pain at the front of the hip is to understand where is this pain coming from. The most common reason we see pain at the front of the hip in the clinic is due to some kind of labral irritation or something called femoral acetabular impingement. Now, this is where you imagine the hip is a ball and socket joint. At the front of the hip is a lip of ligament called the labrum, and that acts as almost like a sucker to live on top of the extend the socket and improve the congruency of the joint and increase the stability. When you run, if this is your knee driving forwards, what happens is the hip drives and puts pressure onto the labrum, which normally it can tolerate and there's no issue. But let's say you increase the intensity suddenly, increase the mileage, increase the speed, the labrum can start to become irritated. And even in certain cases, you can actually tear your labrum as well. This would give you all of the symptoms that we described earlier. Pinching, catching, particularly in deep flexion. So that means where the knee is coming up and towards the chest, or in rotation as well. So lots of squash players have labral irritations. That's because when we're in those positions, that's when the labrum is under the most amount of pressure. If we're doing kind of big lunges into the bottom of the court, then the labrum is most likely to get irritated in that position. That's the most important thing to understand. And the mistake that people make, they do lots of hip flexor strengthening exercises and wonder why it doesn't get better, or they do lots of hip flexor stretching and wonder why it doesn't get better. And it's because we're treating the wrong thing. Physios are seen as, the people who use their hands to get people better or use their rehab to get people better and their exercises. Actually, 80% of the skill of being a physio is in here. It's treating the right thing, because if you think someone's got a hip flexor strain and they've actually got a labral irritation and you're doing the kind of treatment for a hip flexor strain, that person won't get better. They won't get back to running. They'll be wasting their time and the problem may become a more chronic issue. Whereas the physio who's figured out what's wrong, figured out that it's actually a labral irritation, is going to get better results. They're going to get the patient better faster, back to running faster and not waste their time. I have to say that's the most important thing, to get the right diagnosis. The second mistake that people make when trying to treat pain at the front of the hip is using stretching. Stretching feels good and temporarily it might cause a little bit of discomfort, but it kind of feels nice. But for a runner, it's not going to help someone get back to running. Again, I've done this on previous videos, but if the maximum your hip can tolerate is here, you've hurt yourself, and running demands this of the hip. The amount your hip can tolerate is here. The amount of load your hip needs to do to run is here. Stretching is never going to bridge that gap. So it's never going to make a hip be able to increase how much it can tolerate and increase the capacity for load. It's actually probably going to make it less. So if someone's only stretching and not doing anything else and resting from running, their load capacity is going to actually get further away from the ability for them to get back to be able to running. So what that means is we need to be strength training. Strength training has lots of benefits. It's not just about getting stronger. Hypertrophy takes 12 weeks. But the benefits of strength training are seen a lot faster than that. So what I mean by that is to increase muscle mass takes 12 to 16 weeks. So the muscle isn't actually getting bigger during those 12 weeks of someone doing strength training, but there's lots of other benefits. It can have a pain relieving effect and it helps to increase tissue capacity. Again, the hip can tolerate more. So that means we can bridge that gap, get the hip being able to tolerate much more so that it can tolerate running again. And there's lots of other benefits as well. Range of motion, improving daily activities and being able to do things like climbing stairs, sitting to standing, sleeping more comfortably. It has lots of benefits beyond just having a stronger hip. So there's other types of training that I would use in the treatment room for pain at the front of the hip. Plyometrics when it's appropriate later on in the treatment. That's really, really important. We might use isometrics at the start, which is where we're using holds and kind of contracting muscles in a still position, which can be quite a good way to relieve relieve pain. In terms of specific exercises I might do, it might be things like step-ups. There's a study that showed that that's the best way to recruit your glute max. That would be definitely something we would use. Things like side planks I quite like. I find they're quite good for reducing pain. They're obviously quite difficult and a bit painful to do, but I tend to find that patients with this kind of problem, like a labral irritation, tend to get a bit of relief from doing that exercise. All the classic things like bridges and glute bridges and things have their purpose, probably maybe only in the early stages, because it's quite a small range of motion when we're doing a glute bridge. It's kind of terminal hip extension. So yeah, it's good for when patients are in pain. As much as possible and as fast as possible, we want to be getting them in a more challenging, loaded position, like being in standing and step up or something like that. The third mistake that people make is not having a look at their running technique. Now, people do get better without looking at their running techniques, return to running safely, but sometimes when a problem keeps coming back, that's when we start to think, why is it coming back? And that's when we want to really make sure we've looked at the running technique, because there's some studies to show that certain running techniques might make the hip work harder than it needs to, put more load through tissues that may be irritated when we have pain at the hip, front of the hip. So for example, if we have a small knee window, so that means when we're running, we can see very little daylight between the knees. The knees are kind of crossing over each other as we're stepping through, and we're landing in what's called a kind of valgus position, or a kind of dynamic adduction through the hip. That might increase the pressure through the front of the hip. Similarly, an overstride might have the same effect. So that's where the foot lands ahead of the center of mass. That means we're landing in a little bit of hip flexion. Again, that might be a reason why the front of the hip would start to take too much pressure as well. Changing running technique takes 3 months. It's not something that is a quick fix. But certainly at the start of someone's return to running, when we're thinking about cadence, there's lots of changes that we can make to someone's running technique that will help them get back to running more comfortably and also reduce pressure through the front of the hip. Whether they continue that after they've got back to running and they want to carry on changing their running technique is up to them. There may be some running economy benefits, but it's something that we would definitely want to look at to make sure that our runners aren't going to be running into trouble metaphorically and actually. So that's something else that we'd want to definitely look at as well. Thanks for watching. And if you do have any questions, you can leave a comment in the box below and I'd love to help.